Hello, and welcome. You are watching Step Up Medicine's series on cardiovascular physiology. In this episode, we'll break down venous return and preload, two essential concepts that influence how the heart fills, how strongly it contracts, and how it responds during rest, exercise, and disease. By the end of this episode, you should be able to define venous return and preload, explain the key factors influencing venous return, understand the Frank-Starling mechanism, describe the effects of posture, breathing, muscle contraction, and blood volume on venous return. Apply these concepts to clinical situations such as hemorrhage, exercise, and heart failure.
Venous return is the amount of blood flowing back to the heart each minute. At rest, it is equal to cardiac output. Venous return determines preload, which refers to the initial stretch of the ventricular muscle before contraction. More venous return means more preload. More preload means stronger contraction, up to a physiological limit. This relationship forms the basis of the Frank-Starling law of the heart. The Frank-Starling law states that the heart pumps what it receives. When more blood enters the ventricles, they stretch further. This increased stretch leads to a more forceful contraction. Attention. It's an intrinsic property of cardiac muscle. No nerves or hormones are required for this response. However, this mechanism has limits. If the ventricle stretches too much, like in dilated cardiomyopathy, the contraction becomes less effective. So while increasing preload helps up to a point, overstretching can reduce cardiac performance.
Several key factors influence venous return. First is blood volume. More circulating volume means more blood returning to the heart. Second is venous tone. When veins constrict, they push more blood forward. Third is the skeletal muscle pump. When muscles contract, they compress nearby veins and help move blood toward the heart. One-way valves in the veins prevent backflow. Fourth is the respiratory pump. During inspiration, pressure in the thoracic cavity decreases. This creates a suction effect that pulls blood toward the heart. Finally, posture and gravity affect venous return. Standing reduces return due to pooling of blood in the lower body, unless offset by muscle contractions. Together, these mechanisms help maintain adequate preload, especially during changes in body position or activity. Let's apply these concepts to real-world scenarios. In hemorrhage, blood volume drops. This reduces venous return, which lowers preload and ultimately decreases cardiac output. That's why restoring volume is a priority in shock. In heart failure, the heart struggles to pump effectively. Preload may be high, but the heart cannot handle it, leading to congestion and fluid buildup. During exercise, both the muscle pump and respiratory pump increase venous return. This boosts preload and helps the heart deliver more blood to active tissues. Intravenous fluids increase preload and are used to improve cardiac output in hypovolemia. On the other hand, nitrates reduce preload by dilating veins. This decreases the amount of blood returning to the heart, which can relieve symptoms in patients with heart failure. Understanding how to manipulate preload is key to managing many cardiovascular conditions.
Let's review the essential points from this episode. Venous return is the amount of blood returning to the heart each minute. It matches cardiac output at rest. Broader pine. Preload is the stretch of the ventricle just before it contracts. It is determined by venous return. Toe. The Frank-Starling law explains how greater preload results in stronger contraction, up to an optimal point. Venous return is affected by blood volume, venous tone, skeletal muscle activity, respiratory movements, and body position. Clinically, changes in preload and venous return impact shock, exercise performance, and heart failure. These foundational concepts help us understand how the heart responds to different demands and conditions. Now test your knowledge with this quick question. Which of the following would most likely increase venous return to the heart? A. Administration of a venodilator. B. Standing still for a prolonged time. C. Deep inspiration during exercise. D. Severe hemorrhage. Leave your answers in the comments below.
Thanks for joining us for episode 7 of the Cardiovascular Physiology series. In the next episode, we'll explore pressure volume loops, a powerful way to visualize cardiac function and efficiency. If this episode helped you, be sure to like, subscribe, and leave a comment with your questions. Thanks again for watching, and keep on stepping up your knowledge.